Welcome to the North Country Initiative Performing Provider Systems Review of the Blood Pressure Measurement Clinical Practice Guidelines. The following training is brought to you by the NCI Medical Management Committee. This brief review will provide you with recommendations for best practice based on the American Heart Association guidelines for measurement of blood pressure. These recommendations are intended as a reference to inform best practice and not to dictate policy and procedure in a specific office. Each practice should be familiar with the recommendations and adopt the ones that ensure accurate readings while maintaining feasibility for their organization. The most important commonly performed office test is blood pressure measurement, yet proper technique is often overlooked in order to maintain office efficiency and timeliness. Inaccurate blood pressure readings can be associated with unintended adverse outcomes. Overestimation can lead to medication side effects, while underestimating blood pressure readings may result in stroke or other significant cardiovascular events. Additionally, inaccurate blood pressure readings may also affect your practice performance scores, thereby reducing your perceived contribution to quality and value. In a value-based payment environment, lower performance scores will negatively impact your bottom line. With this understanding of the importance of accurate blood pressure readings, we will now review proper technique.
The ideal patient preparation for blood pressure measurement includes no caffeine for 30 to 60 minutes prior to measurement and no smoking or exercise 30 minutes prior to measurement. The patient's bladder and bowel should be comfortable, and there should be no acute anxiety, stress, or pain. The environment should be quiet and relaxed with no talking by patient or staff. The patient's arm should be bare with no constrictive clothing. The patient should be seated for at least 5 minutes with the back well supported, the arm relaxed and supported at the heart level, and the legs uncrossed with the feet flat on the floor. It is important to use the right cuff size in the right position. The cuff bladder length should encircle 80% of the upper arm circumference, and the cuff bladder width should be close to 40% of the arm circumference. The lower cuff edge should be at least 1 inch above the elbow. The cuff arrow should be aligned with the brachial artery. Here is a table of blood pressure cuff sizing. The appropriate cuff size is determined by the arm circumference. Using the wrong cuff size can lead to significant measurement error. Measurement procedure. It is important to use equipment that is accurate and routinely calibrated at least every 6 months. Position the patient's arm level with the heart. Position the palm up. Expose the upper arm. Squeeze the cuff to expel any remaining air and close the valve on the bulb. Find the brachial artery at the inner aspect of the elbow. Locate the arrow on the cuff. Place the arrow over the brachial artery. Wrap the cuff around the arm at least 1 inch above the elbow and assure it is even and snug. Place the diaphragm of the stethoscope over the brachial artery. Do not place it under the cuff. Inflate the cuff to a pressure 30 millimeters above the level at which the radial pulse is extinguished. This helps to avoid underestimation of systolic blood pressure. The rate of deflation of the cuff is approximately 2 to 3 millimeters of mercury per second. Systolic and diastolic pressure should be read to the nearest 2 millimeters, avoiding rounding up or down. A minimum of 2 measures should be taken at least 1 minute apart, and the average value should be reported. If the measures differ by greater than 5 millimeters, then perform an additional 1 or 2 readings, waiting at least 1 minute between readings. Here is a table of the magnitude of measurement error when proper techniques are not used. As you can see, not following proper measurement recommendations can lead to considerable error in blood pressure readings. The last factor is digit bias, and it refers to rounding to the nearest zero. This is a very common measurement error that can have implications for patients as well as quality performance reporting in a value-based payment system. Studies have demonstrated that in the office, automated readings are lower than manual readings. Potential advantages of automated methods include minimizing the white coat effect, reducing observer error, facilitating multiple readings, controlling the deflation rate, and automatically calculating the average of multiple readings. Other potential sources of error in blood pressure measurement technique include a lack of concentration of the measure, lack of repeated measures, time between repeated measures, increased muscle tension, a poor quality of the stethoscope, and a low level of training of the measurer. In summary, blood pressure measurement recommendations are intended as a guideline to inform best practice and not to dictate policy and procedure in a specific practice. Each practice should adopt the blood pressure measurement recommendations that ensure accurate readings while maintaining feasibility for their practice. Inaccurate blood pressure readings can lead to over or underestimation, which could lead to adverse outcomes. Inaccurate blood pressure readings may affect a practice's quality measures, underestimating the practice's contribution to value. Thank you very much for your attention.